Hello everyone, my name is Sara Iqbal, and on behalf of the DBT Welcome Trust India Alliance, DBT THSTI, IRV and Nature India, I would like to welcome you to the fourth webinar in the series on COVID-19. Thank you very much for joining us this Friday afternoon. I hope all of you are doing well and taking good care of yourself, your loved ones and your community. Our last few webinars primarily focused on providing scientific and health related information on COVID-19, which was really an attempt to counter misinformation and also counter the lack of credible information available in the public domain. However, we realize that people are at the heart of this crisis. As much as we need to focus our time and resources on scientific and medical interventions to contain this outbreak, it is equally important for us, if not more, to timely, effectively, and compassionately communicate and engage with people, and also view them as partners in finding solutions to control and contain this outbreak. Therefore, this webinar and the ones that we plan to host in the next few weeks, we change gears slightly and plan to cover a whole range of topics related to risk communication and community engagement during a pandemic. So even as we try to address public fear and stigma through timely and scientifically accurate communication, an important aspect of communication that is generally overlooked, or for that matter, not given much importance, is the language used in communicating this information. So at today's webinar, we will try to understand and deconstruct the role that language plays when we talk about a pandemic. But before we move forward, I would like to introduce the people behind these webinars, my colleagues at India Alliance, Hina Latif Nizami and Yukti Arora, Devalina Bose from IRV, and Shuli Mitra from THSTI. Also very quickly, a few housekeeping rules to make sure that this webinar runs smoothly. Just wanted to inform you all that the webinar will be recorded and it will be shared widely. Thank you for sharing your questions with us. We will try our best to cover as many as possible during the course of this webinar. You can also submit your questions anytime in the question box, which is in your right-hand side console. I also want to highlight that panelists at the webinar are providing their views on the current situation as experts in their respective fields and are not speaking on behalf of the government or associated organizations. Right, so I'm delighted to introduce our three speakers now. We have with us Dr. Soumitra Pathare. Soumitra is a psychiatrist and director at Center for Mental Health Law and Policy at ILS Pune. Soumitra has been instrumental in drafting India's new mental health law and has been a member of the policy group appointed by the government to draft a new national mental health policy for India. He's also the project director of SPIRIT, an NIMH-funded hub for suicide prevention in Southeast Asia, and a member of the Atmiyata team, which is scaling up a lay volunteer-based community program to improve access to mental health services in rural Gujarat. So welcome to the webinar, Soumitra. Next up, we have Ida Juice, who is an award-winning journalist and a media technical expert. She, at Internews, Ida is working on the Ebola and post-Ebola response in West Africa and helping the media of priority sub-Saharan African countries create an enabling environment for HIV biomedical prevention research to thrive. So welcome to you as well, Ida. And last but not the least, we have with us Padma Priya. Padma Priya is the co-founder and editor of Suno India, a multilingual, multi-generational podcast platform for issues that matter. She has written for leading media houses and has worked as an advocacy and communication specialist for Doctors Without Borders. So thank you, all of you, for joining us today.
Right, so for a meeting ID. I'm now into the software, but it's asking me for a meeting ID.
So lately, we have been seeing and hearing COVID-19 being likened to a war. Such parallels have been drawn in previous outbreaks as well. And phrases that are being used are the fight against COVID-19 is a people's war, tackling the pandemic on a war footing, and wartime precedent. And these are just a few in a long list of war metaphors that are being frequently used in the media and other places to highlight the impact and scale of the crisis. But does comparing a pandemic to a war really needed? And how does use of such metaphors influence public understanding of the health crisis and ultimately their response to the crisis? So, Shoumitro, if we can start with you first, can you please help us understand the effect of language used in pandemic communication on human psychology? How does it really shape our response to the crisis? Over to you.
Thanks, Sarah. Thanks for inviting me to this webinar, and I'll try and cover as much as I can, including some of the questions that have been asked. But feel free to interrupt me if I'm going way over time in some sort of way. So just to start off with your point about the war metaphor that is being used, it's being referred to as a war. A lot of our public personalities tend to use this term. Even on social media, you see hashtags like Corona warriors, Corona fighters, Corona war. And actually, this is not new. I mean, this has happened before. We've seen that with cancer. We've seen it with HIV in the past. And I'm sure there are lots of merits in why this war metaphor is used. It might have advantages in galvanizing society to put up with hardship when you have these situations. But I kind of see very specific problems, especially from the health sector perspective. Broadly, I'm sure there are other problems too with the war metaphor, but with the health sector, there are a few particular problems. One is that once you call it a war and you call health workers as warriors, then they are expected to behave like soldiers, which means stoicism, heroism. This is the kind of stuff that healthcare workers are then expected to show. So for example, the expectation is that healthcare workers, doctors, nurses, ASHA workers should not complain about lack of personal protective equipment, for example, or the poor working conditions in the hospitals they have. Also, there's an expectation, like soldiers, that healthcare workers should not be speaking to the media. And that creates another problem, which means you're just expected to be quiet, do your work, and not identify or raise problems. The other issue that the war metaphor does is actually wars need enemies, and how do you fight unseen enemies? A virus is an unseen enemy, and so when you can't fight an unseen enemy, I think enemies start getting manufactured. So, for example, in the past, we've seen, just to use one example, in the Second World War, for example, U.S. citizens of Japanese origin were seen as a fifth column and were then interned for almost throughout the war. And similarly, individuals and communities can then get designated as enemies. And that creates a problem for the health sector too, because are you then not supposed to provide good quality health care to these so-called enemies? And so that's another problem that it creates for healthcare workers. And third thing that is happening is much more global rather than local, is that a certain amount of collateral damage is seen as acceptable. We need global solidarity out here, but what the war metaphor does is that it breaks down the global solidarity. So we've kind of heard attempts to call it a Chinese virus, and it becomes a matter of nations fighting each other. It's also, if you see the attacks on the WHO, that's a kind of fallout, as I see it, from this notion of a war that countries are fighting. Because then somebody gets designated as an enemy. In that case, WHO is now the enemy. And also because it's a war. Yeah, sorry.
Go ahead, Shoumitro. I think Ida is having some technical issues on her end. Please go ahead.
Okay. Well, also, when it is a war, it seems everyone's for themselves. So, countries are diverting supplies to themselves. So, for example, there was media reports that certain consignment of rapid tests, which were meant for India from Singapore, got diverted to USA. And that's all seen as all normal, because it's all seen as part of the war metaphor that we are into. So that's one issue with language, the war metaphor. The other important issue that I find with language has been the use of words like corona suspects. I mean, I've seen that repeatedly in our press. People being referred to, people who may have, or who are suspected to have the coronavirus, referred to as corona suspects, or terms like corona suspects escape from hospital. Now that's a real problem, because it kind of uses the metaphor of criminalization. These are not people, first of all, who committed any crime, and they may have a health condition, but the use of that language then makes it very criminal. And once you do that, I think it also then justifies violence, either verbal violence or physical violence against these so-called corona suspects. So I think that is another part of language which creates a problem in the health sector. And finally, what language does do as a health professional, I think, is that it can create fear and panic. I mean, we know that we want people to stay at home and follow instructions, and so there has been a lot of focus on using fear, telling people don't step out or you'll get ill and all. But the problem is titrating that is always very difficult, and too much fear then leads to panic. And more importantly, if you look at our past experience, say with the HIV epidemic, appeals to fear don't work. I mean, one of the things that fear then does is that people stop coming for testing early, or you even see things like avoiding healthcare workers coming to their home for contact. There have been episodes where healthcare workers going out to do contact tracing have been attacked. So too much of fear is also a problem for the healthcare sector, and that's something that we really do need to address. And I'm going to end with on a slightly positive note, because I think it's important that we realize also that there are positive things that we can do, which is that we could actually use some other metaphors, and there is we need to move away from metaphors which create the idea of winners or losers. So for example, people have suggested we could use metaphors which are more drawn from ecology. So you see the pandemic more as a journey, or you see the response to the pandemic as something that is an orchestra. Why a journey? Because journey requires planning, there'll be some obstacles, and you'll ultimately get to your endpoint. So you could see the pandemic as use a metaphor of a journey. If you see it as an orchestra, for example, that requires a coordinated action, it requires working together. And I think fundamentally, as the German president said the other day, the pandemic is a test of our humanity. And I think we need to really succeed at that test. There are many other tests, but we can't afford to fail the test of humanity. So there were some questions about, so how do you avoid stigmatizing language? I think one of the things about avoiding stigmatizing language is to focus on the human person behind the illness. So rather than focus on the illness, you focus on the person. And that can happen even simply by not referring to people as COVID-19 patients, but to say a person with COVID-19, because it separates the identity of the person from the illness. We need to actually focus on the human being with the illness. So, they are somebody's mother, father, brother, son, daughter. And I think it's important that you focus on them as persons and human beings who who have fears, anxieties, concerns, worries, and those are the things that need to really be addressed. I also think that it's important to avoid invoking fear. So, for example, repeatedly saying that COVID-19 has no cure, it can be fatal, so many people have died. I don't think that's really helpful at all. It does not help anybody to keep on repeating that ad infinitum. And as far as trust goes, because somebody asked a question, how do you inculcate trust in communication? I think that requires a more transparent communication. Transparency, to my mind, is the best disinfectant against mistrust. And that's probably the thing that we need to do. As much of information as transparently as can be provided in as simple a language so that people can get it, I think is great. Just yesterday, there was this wonderful example of great science communication from the German Chancellor, Mrs. Merkel, explaining what RO meant and how that would affect people. I thought that was a great example of explaining that to the average person who may not have a science background. And finally, to take that one question, somebody asked that how do you talk to children? There is a book which has been prepared by the Inter-Agency Standing Committee on how to explain COVID to children. I can send you a link, but if you search for it, it's there. It's available in many languages, and it's an excellent resource, and it's written in the form of a story, how you could tell it to children. So I would just point you in that direction, really. I will stop here now, except to make one last point, which is that I do a lot of work in suicide, and what we find is that with suicide reporting, we've got a lot of problems with media reporting of suicide. So, the use of words like committed suicide and all, and we've repeatedly tried to get media to change away from that. So this is not COVID specific, but it seems to have continued into COVID. So any of you media people out there, I would suggest download the WHO guidelines on suicide reporting for media, and please try and follow those guidelines. That will be really helpful. I'll stop here, Sarah, and over to you back again.
Thank you, Soumitra. That was a great start to this webinar. You've set the stage very well, and we'll be back with more questions. Maybe we'll now have Ida. Ida, are you there? Are you online now? Okay.
I am. Can you hear me?
Oh, you are. Okay, wonderful. Great. So Ida, can we have you next, and can you tell us, drawing from your experience and expertise of responding to an outbreak like Ebola, what lessons have we learned from the previous pandemics, and what kind of terms should we be cautious of when writing or reporting about COVID-19? Soumitra touched upon some of that already. What would a language of compassionate and empathetic reporting, what would that look like? So over to you now.
I can hear there's an echo, but can you hear me as a single voice now?
There's a little bit of echo, Ida.
Okay, that's a pity. I'm so sorry about that. Quite know how to get rid of it. I'm sorry. Could you maybe go to the other speaker and I'll try to sort that?
Sure, we'll do that. All right, so while Ida fixes these the technical glitch, Padma, over to you. Considering your experience of running a multilingual and multi-generational media platform that covers a whole range of issues, what would be your advice on communicating pandemic-related terms to people who speak different languages from different generations, who are all affected by this outbreak, perhaps in varying degrees? And also, maybe can you touch upon what can be a person or a people-centered approach to communicating risk? Yeah, over to you.
Thank you so much for the opportunity, and I think Dr. Soumitra, very rightfully raised some very important points. I would actually want to start with sort of talking about how it has been for me as a journalist and as someone who has worked in health communications, watching the coverage and watching the pandemic sort of unfold in the world and especially in India. I think one of the things that stands out for me is our, I think, failure. I don't want to sugarcoat this, but I do feel like we have failed in sort of communicating sensitivity and empathy towards those who are affected by the disease. And I think one of the things that we are noticing, and what I have been observing from the beginning, I've personally heard not just anchors of TV news channels, but even chief ministers of many states themselves, in many instances, use policing language or criminalizing language towards patients. We had one chief minister actually call one of the patients, as a stupid person who carried the disease back home. And there is also, one of the director of public health services, for instance, referred to one of the patients as being kept in custody and not in isolation. And there is a lot of difference, in how you communicate, and especially as somebody who is leading a state or who's leading, say, a health department, it's extremely critical and extremely important that the right language is used. And as it was rightly pointed out by by the previous panelist, I think the use of corona suspects is really not the right kind of language. The headlines have been very disturbing. We saw a very viral article talking about a patient fleeing from Bangalore to reach Agra, and a patient escaping quarantine facilities. I think these are just some of the handful of examples that I can give, out of the ones that I'm keeping tab of. What we seem to have forgotten is that very little seems to be known about this infection. Not many even know that they're carrying it and that this has no cure. So empathetic language has been thrown out of the window. The war metaphors, I don't want to go too much into it because it was really touched upon in a very succinct manner by the previous panelists. But I think what it is also leading to is that it's also giving people who are not at the front lines this belief that yes, the ones who have to fight this are the health workers. And yes, it is sad that there are not enough PPEs, but now it is their turn. It is now their duty. And we seem to forget, most importantly, the doctors, nurses, the ASHA workers are people and human with emotions. And I think what has led to this is and one of the biggest challenges remains the massive disinformation that has spread. And a lot of the disinformation and the misinformation is also coming because there is an information vacuum in a lot of places. For example, I'm based out of Hyderabad. Telangana has not been great in terms of how it is communicating to the journalists. We have been struggling as journalists to get any sort of valid information out of the health department themselves, repeatedly requesting even health department to do interviews where we say, listen, can you help us put out actual information? Let's do some myth busting. Itself is not even being encouraged. So there is a huge vacuum that has been created, which is being filled by fake news, by WhatsApp information. And the language barrier, coming to that, I really think it is there. And one of the ways that we, at least at Suno India, how we've been trying to do that is really early on, we used our Telugu news show to get an ex-government doctor who's right now in the private sector. We had him come on board, and he was also one of the first doctors to identify a case of swine flu in the country. And we had him come and sort of do a bit of myth busting. Does turmeric cure COVID? Does eating garlic help treat COVID? And all the other sort of misinformation that was coming out. And he did it in this very matter of fact, but also in a very engaging and fun manner. For example, he made a statement saying that, sure, drink all the healthy water that you want, but once you get COVID, we don't even know what we need to do. All that can support, what can support right now is a supportive therapy. And he also, used very basically used metaphors and language that anybody can understand in Telugu. And I think that's the kind of language we need more experts to come out and to speak in, to speak like you would be speaking to your neighbor or to your friend, or how would you talk to your friend about COVID, right? I mean, you wouldn't be talking about RO factors, and you wouldn't be talking about flattening the curve and physical distancing. If you had to explain it, you will do it in very simple terms. And I think that's something that we've been really trying to do in our reporting, which is to sort of simplify the jargon, to sort of get people, experts also, to sort of explain how is this spreading, what can I do as a citizen to avoid it. So just some of the things. I just want to take maybe just a minute to sort of also talk about the other things that have been done in the run up to managing this pandemic prior to the lockdown. I think using quarantine seals and placing stickers on those of those who are in home quarantine, it may seem like an effective strategy, but I feel like the societal implications are not being taken into consideration. I spoke to somebody who had a sticker placed outside his home. He had returned from abroad, and he was not informed by the health authorities that a sticker was being placed outside. And he woke up one morning to find the sticker outside his house, and with with people just refusing to deliver things at home, shopkeepers refusing to send groceries over, or allowing him to even step out. Like neighbors were not allowing him to step out, and though he was in home isolation, and it was his family members who were doing most of it. I asked him how did he feel when he saw that sticker, when he knew that there was a sticker placed outside his home, and he said what he felt was shame. And I think it's really sad if this is the kind of message that public health authorities or even we in the media are giving out, that if you have COVID, you should feel ashamed. There is nothing to feel shame about. You didn't know you had it, you have it now. What we need to assure these people is that we will give you the best care possible. But what's happening, unfortunately, is that there is this criminalizing that's happening. We're using words and phrases like super spreaders. I don't know, frankly, the medical basis of that phrase, but I do know that calling somebody a super spreader has a huge impact on how they feel about themselves, and how or if you actually put that phrase or that sort of a label onto an entire community, it has huge impact. I mean, there is fear. You will have people turning away from even accessing healthcare facilities. You will have people not allowing healthcare workers come into their their homes. I think it was during one of the polio immunization campaigns. There was this message that went around saying that that this the injection itself could cause death, and there was a lot of fear among the community, and they actually refused the polio immunization. So the fear, when it takes over, it sort of takes over the rational side of us as human beings, and has graver public health impacts. And I really feel like these are things that really need to be addressed. And I do agree very much that the humanizing aspect of this pandemic is not happening. I think now it's gone to mere numbers. Like every day there is data crunching happening, that 1,000 new cases have been added in India, 1 million more in the world. And I think we seem to forget that these are family members, and unless it hits us close home, we seem to not be able to empathize and understand what they are going through. And largely, I do believe this is because of how the reporting has happened so far. I will give a lot of credit to the hardworking health reporters out there who are doing everything possible to get us as much information as possible. But we are also facing roadblocks. We are not being not all state governments are being super accessible, like say a Kerala, for example, or Tamil Nadu, for example. Not all state governments are doing that. The other question that I was asked about one of the things that I was asked about was, how is information trickling down to media geographies? I think we can agree that the radio penetration is quite high. And I do believe that some people are getting their information from the radios. Community radios are doing some very incredible work when it comes to the spreading, the dissemination of messages. It's very, very important, the role of community radio stations, especially when it comes to vulnerable populations, because they need credible information in their local language on how they can protect themselves against COVID. We did this episode on how the lockdown is impacting farmers, and one of the things that the speaker told me was that the farmers don't understand, like, if they go to the fields, what is it that they are supposed to do to keep themselves safe? What are the things that they're supposed to do? Like, what are the measures that they're supposed to take to keep themselves safe and their family safe? So how do you communicate to them? And I think there needs to be special and very concentrated focus that needs to be done here. And I think community radios are a great starting point, and some of them are doing some fantastic work already. In places such as, say, like the interior tribal communities, which have, say, no access to these kinds of means of communication, we are seeing there's, I think, one, an ex-Maoist turned MLA in Andhra Pradesh. She is now walking into these remote places and delivering ration, but also telling them what is happening outside. How is this disease spreading? What do they need to do to take care of themselves? I think here it is really worth investing in sort of good old traditional methods of health education, where you send a health educator or a doctor and you sort of talk to the communities. And it's a good starting point to actually start off and kickstart some really good behavioral communication, behavioral change in that sense, right? ASHA workers are playing a very critical role in these media dark geographies. They're going door to door, and they're spreading the information. But for me, what is concerning, we spoke to some ASHA workers, we did an episode on this, and I spoke to some ASHA workers, and I asked them, have you been trained? Have you been told what this whole thing is about? And they said, no, we have not been. All that we know is through TV channels, or through newspaper. We have our information from media. We're not getting it as, say, handouts, or they're not all ASHA workers are getting trained. Maybe I think like a minority are getting trained in disseminating the messages. So they themselves are relying on other forms of communication for this. And I think we need to also factor in the fact that these people also face stigma. They also face fear. One ASHA worker told me that every day when she goes back home, her husband taunts her. He scolds her, saying, why are you doing this? And he's not letting her sleep inside the house, so she sleeps outside the house now. So there are all these things that seriously need to be taken into consideration. I think I'll sort of stop here and not go on and on.
Yeah, thank you so much for those very, very important points that you raised, and we'll be back with questions that have been coming in. There are quite a few already in, but maybe we'll have Ida now. Ida, can we have you next now? She can't hear us.
Great. I think you can hear me now, right?
Okay, yes, we can. Perfect.
Wonderful. Speaking of language, unfortunately, at first my computer and the platform didn't want to talk to each other, but I think now we can all talk to one another. I agree so much with what Dr. Sumitra and Padma have said. And I thought just to add a few more words to say that we humans invented language. We are clever enough to know how to describe things. And there's a new coronavirus out there. I think we can think of ways to not be stuck in a war metaphor, as both the two speakers have said. We can think of ways to be more empathetic so that our language is not stigmatizing. And importantly, as we get to know this virus as science journalists and general journalists, we tend to be getting very clever. We know about R0. We know exactly what flattening the curve means. We're following the clinical trials, and sometimes get ahead of ourselves as journalists and forget that we spend a lot of time researching all of this online, speaking to scientists, listening to scientists, but our general audience just wants to know what it means for them. What about that language? What about the science is useful for them? So I just think that a lot of the things we have to say as journalists and as people to one another about this new virus are words that we may still come up with in time. Just as science is evolving, our language is evolving. Let's go to the next slide. It was fascinating that in this past week, the New England Journal of Medicine actually produced an article which told us that literally speaking, the little bit of saliva, the droplets that we produce when we speak, especially when we say words like the and catch and thank you, those TH words, New England Journal of Medicine actually showed us a visualization of what happens, and that when we speak, we can put people around us at risk. That's, of course, the literal meaning, but we can also put people at risk in the way we speak, through the language we use, through the words we use in the writing that we do. Let's go to the next slide. Both speakers have already spoken about war metaphors and how we increase tension and conflict when we get stuck in those metaphors. We've heard a prominent president, describe himself as a wartime president. We've heard about battling the virus. We hear about immune defense systems and, those typical metaphors that are usually used about the soldiers in our bodies that fight the virus, that fight any pathogen. But what about, instead of a wartime president, thinking of people like Angela Merkel, whom Sumitra mentioned, and also my own president, Mr. Cyril Ramaphosa. He was decisive, he was informed, led by science, and also very empathetic right from the beginning. That's not what a wartime president, that for me, I wouldn't describe that as a wartime president, though I'd like to have him on my side when things are tough. I think let's rather emphasize what is positive about the decisiveness, about being informed, and about being empathetic. We talk about battling the virus, but maybe the person is receiving attention. Maybe the person is coping. From the world of HIV, UNAIDS has for decades now published lists such as the one that I've put up here, which tells us, sort of this about the stigmatizing and sometimes scientifically inaccurate terminology that people tend to go to before they sit back and think. And I'm suggesting perhaps we can do the same for this new coronavirus, for COVID-19. Think of all the stigmatizing, all the unnecessary conflict-laden language, and think of a new way to describe things. Let's go to the next one. So another trap, so that in the next slide, I mean, we all have seen the flattening the curve curve, right? And we also have to acknowledge that all of us as journalists get exposed to it. We've heard presentations where it's being described. We all probably had mathematics or statistics or something like that as a subject at school. But at the same time, when you see it visually, you can already begin to understand what it means, but only if you've actually been exposed to graphs like that. And even if you've been exposed to graphs like that and you don't have the luxury of seeing it visually, for instance, if you're speaking on radio, then what does flattening the curve actually mean? I've seen in the next slide another way in which this is being described. This is from an article in yesterday's Washington Post. On the next slide, you see how the idea of exponential growth, just go back one to the previous graphic. Go back one slide, please. Yes, in this graphic, we see a very, I would like to have the one in the middle. After this slide, please go to the next slide. Please stay on this one. So what we see here is from yesterday's Washington Post, an illustration, so using visual media to illustrate to us something that, I think all of us who followed this epidemic have seen how people tend to want to compare the mortality rate to, for instance, malaria or the number of traffic accidents or HIV, depending on the context. And we know how inaccurate that is because of the exponential growth, because of that curve, because of the trajectory. What this visualization shows us is that as of now, COVID-19, this is the US, by the way, COVID-19 is an equal to the first killer, which is diabetes and heart disease. And so even those previous comparisons are wrong, but it actually shows us the yellow dot that moves along so rapidly in a mere 3 months, shows us a bit of an illustration of what exponential growth means, like one of those scientific terms we hear a lot, but which we try to communicate to our audiences. And now what do we do if we don't have the luxury of visualization, if it's radio, for example? So let's go to the next slide. I've mentioned only a few examples, and I think both speakers have already mentioned others. All of us can think of all of those other examples in science, like, for instance, the technical name of the virus itself versus the fact that there's coronavirus, there is COVID-19, kind of, we tend to get very trapped in what that actually means technically, what exponential growth is. Once we get it, it's very clear to us, but now we need to transmit that to our audiences. So go to the next slide. These are just suggestions, and of course there are also contextual ways and beautiful metaphorical ways to put things differently. But what do we mean? We just mean when we slow down, when we flatten the curve, we slow down the rate of infection so that health systems don't get overwhelmed, and we buy time to be able to respond. When we talk about social distancing, it sounds so clinical. It doesn't sound like the way that humans interact. We perhaps should just say, don't get too close to the people around you. When we talk about exponential growth, it's quite difficult to explain, but perhaps we just say there's a very rapid rise in infection and then it continues to grow even more rapidly. Let's go to the next slide. So, of course, a principle in medicine and also a principle in journalism is first do no harm. I wanted to really talk about the Wuhan virus because I think we've all noticed this incredible explosion once again of anti-Chinese sentiments. We know why WHO decided, I think something like 4 or 5 years ago already, to not name a virus after its place of origin again. We should name it for its technical and scientific name. Or we should say this new coronavirus. It's not the first coronavirus, so we are communicating something in science, but we are not doing harm to the people of Wuhan. And we're not further increasing those anti-Chinese sentiments that are unfortunately on the rise again. We talk about imported cases. It makes a person sound like a commodity, like a piece of shampoo or something that was imported from another country. The word index case, I really hate that term, because just as Padma has also said, it's as if we think we know who the first person with the infection had been, when we all know that pyramid that shows how many people are usually either have no symptoms or very mild symptoms, and who may be infected and don't get tested. Where do they fit into when we even go there? Just don't go there. And from the world of HIV, we also have all rapidly embraced this idea of not talking about only people who are infected, but to acknowledge that truly, truly, all of us in the world are affected by this virus. And the way that we do no harm is to not do any othering. We always hear about they, the patients, them, how to treat them, how to handle it. It's actually all of us, it's we. Not only because the entire world is affected, but also because all of us could be infected and not know it, or many of us could be infected. We could have had a mild infection and have never been tested. And I just wanted to end there and say, whether it's the conflictual side of it, or trying to be too clever with the science, or whether it is about not sitting back and thinking empathetically, our words can do harm. And perhaps we can draw up lists like these for ourselves, and I think the list will evolve as we learn more about the virus, just as the HIV lists have evolved as we've learned more about HIV. Thank you so much.
Thanks a lot, Ida. That was extremely helpful, especially that list in the end. I'm sure it's a good idea to, prepare that, develop that, and use it to make sure we are, being sensitive and compassionate. Soumitra, I have a question for you. Recently, the Prime Minister of Norway conducted a press conference only for children, where she told them it's okay to be scared. So, how can we talk about this outbreak to young children? You also mentioned about this book that is under work. So, can you maybe spend a few minutes on this topic?
Yeah, thanks. Not only Norway, I think the Prime Minister of New Zealand did the same thing, and she was quite funny about the Easter bunny and Easter and missing out on Easter. So I think some leaders have taken the kind of lead in talking to children. I think the first and most important thing that we all need to know, forget children, is that it's okay to be anxious. Okay. In given circumstances, anxiety is a normal reaction. Too much of anxiety might be bad for you, but anxiety is a normal reaction. So I think instead of trying to say, don't be anxious, which kind of actually negates your experience, and then you feel, oh my God, I can't talk about it. I think it's probably good to start by acknowledging that it's okay to feel anxious given the kind of situation we are in. And then actually try and break down that anxiety into saying, okay, how are we going to deal with that? There are some things that are worries which are in the future, which may or may not happen. There are worries about something that is there today and tomorrow, which may or may not happen. And how do we deal with those fears? So I think when you're talking to children, I would think that it is no different to talking to adults. You might just have to change your use of words or the kind of complexity of the sentences that you're using. But I think fundamentally, the talk to children has to be the way you would talk to adults, which is acknowledge the anxiety, look at how you can deal with the anxiety, look at things that you can do about things rather than things that you can't do anything about. And to actually say that, look, we are all around for each other. I think one of the problems with social distancing and the term social distancing has also got translated into meaning that we are all now islands by ourselves, and that we are supposed to look after ourselves individually, and we are responsible only for ourselves. I think that's a terrible notion to try and spread. If we are going to save ourselves, then we are going to save ourselves as a society. And so there are people in the society who will help you, and vice versa. You help other people. So I think it's important to get that message out. The term social distancing actually has caused a lot of harm, I think, in many sorts of ways.
Right. Thank you. And what would you what would you have to say also about, and that perhaps this is for all three of you, about that communicating to the elderly who are most vulnerable at the moment? How do we communicate to them sensitively?
I think one of the things that I could say is that we often communicate about them instead of to them. When we have those, headlines about most at risk, more at risk, more vulnerable, it's again a form of othering, saying as if to almost say, "Whoa, that's a sigh of relief. I'm not at risk because I'm under a certain age." So I think apart from communicating to them, of course, just when we communicate generally, we should be careful with words, and that goes for other groups that are at higher risk. So since there are no real broadcast or media channels which are specifically aimed at the elderly, I think that a lot would be achieved by just thinking that in any general communications, to just not make out as if this is a group that is other or different, and not forgetting that all of us will be the elderly, hopefully, one day.
Padma, do you want to add
While
anything, or Soumitra?
I would just, sorry, Padma, do you want to go ahead and I'll do last?
Okay. I think one of the things that when it comes to communicating to elderly, like the thing that came into my mind was my own parents, right? This is a very unusual situation for a lot of our parents in their 60s or in their 70s, and our grandparents. And I think saying constantly that they are at risk and then adding a layer of fear to it is not going to help. I think just communicating, like Ida said, in general, just being very careful and weighing the words very carefully and telling that it's, the reason why we are not able to come visit you or why we need to stay indoors is because there is so much unknown about it. And I think we really need to, the other thing that we really need to drop is we need to stop patronizing people. And I think that's happening a lot because of this communication. Like communication right now has become very one way when it comes to, especially in a country like India, where there's a lockdown and we are being communicated at and to, and it's like a one-way street that's right now happening. People who have doubts, who have fears, they don't know how to express it, or they don't exactly know where to share it, which is why it's even easier to sort of capitalize on that fear by spreading misinformation, by saying that standing in 35 degrees sun will help you beat COVID. I mean, just on the base, just kind of misinformation that's even coming in our own family groups. It's mind boggling for me. Like today morning there was a new one about I think something to do with the pH levels in fruits and vegetables, and which one we need to eat more because the virus can be beaten by pH levels. I mean, it's like pseudoscience at its best. But I do feel like because there is this fear, there is the fear of unknown, people are also willing to consume this sort of information. And I think this is where it's really important to sort of just take a step back and tell people, have a conversation, right? I mean, one of the things that we did, which we're doing now as Suno India, is we've put out these flashcards in 3 languages, in English, Hindi, and Telugu, where we are taking some of these commonly believed myths and we are synthesizing this in very easy to understand, like as if if I were talking to my mother, how would I talk to her about will the COVID die in summer, like how would I explain that? So we sort of synthesized it and came up with these flashcards in collaboration with an Iranian artist. And it was very funny because they got widely shared, and in fact the flashcards came back to us in another group, so they did a whole round and it came back to us, the ones who created it came back to us, which is what we really want when we are disseminating information. So I do feel like what people are now telling me more and more, whether it's my friends or others, even our own listeners, is that it's now become overwhelming for them. The information output is too overwhelming and they need somebody to synthesize this in simple language. So like Soumitra said, social distancing has a very different, it takes a very different connotation even in cultures like ours, right? There is an entire caste class angle to this. That's not what social distancing is, right? So which is why I think a lot of countries now have moved to adopting the physical distancing aspect. India Science, I think this group of scientists have come together to do really good science communication in different languages. They're doing a splendid job too in the way they're putting out information. So I think I completely agree with the other panelists. The othering shouldn't happen. And I think We all should now step up, as journalists, as people in the communication sector, to sort of support and help, especially the most vulnerable sections, in getting the right information.
Okay, thanks, Padma. Shumitra, do you want to add something? You wanted to add something to this?
Just a couple of points, picking up on what Ida said and also Padma said. I think while it is important not to emphasize that the elderly are at risk, I think you could convert that into a more practical and focused discussion. So, for example, to have a discussion around the fact that, look, have you done your will? These are practical things that you could encourage people to do, or things like, have you written out an advance directive? Would you want to discuss what an advance directive should be like? What would happen if you went to hospital? If you did have to go to hospital, what do you want done for you or people left behind? Practical things. You might have a dog or a cat, and if you're going to be in hospital, who's going to look after that? So I think focusing the conversation. So while it's important to say that, yes, you are at risk, but to convert that you're at risk into, okay, what can we do to mitigate those risks, as well as what can we do so that you're able to deal with those risks. I think a more grown-up conversation is probably useful.
Thank you for that. We don't have much time left, so there's one question that I want to pose to all three of you, and that is, what you mentioned uncertainty of the outbreak and uncertainty of the situation. So what language can we use to communicate uncertainty? A lot of people are wondering what will happen after the lockdown, when will we have a new vaccine? So how do we communicate this uncertainty to people? What kind of language should we use?
I think it's a real problem. I don't think that any one of us has a clear answer to that. It's a real problem because I remember about a month ago when I was traveling in an Uber, and the driver said that science has progressed so much, why can't they find a solution to it? And trying to explain to him that how science progresses and how science works, and finding a solution is not a matter of a couple of days. The problem is that people are looking for certainties, and then there are other people offering certain answers, that non-science, if I can call it, or nonsense in many ways, will offer certain answers. Religion, for example, does tend to offer certainties and answers. And science faces this challenge of saying, look, we're always uncertain. That's the method of science. So I think it's a real challenge. I don't have a easy answer to that, but I think the problem has been created by us in the first instance, because we've always kept on saying we have the answer, we know the answer, science will solve it, without actually letting people understand how the method of science works. So yeah, I mean, I don't have an answer, but I think we need to really think about it.
Maybe I'll add to that. I fully agree, of course. A beautiful piece I read again in the New England Journal of Medicine, reminded of a quote by Susan Sontag, who said that many times when we use these metaphors and the metaphors of calamity and a perfect storm and so on, we also are disenfranchising people who are perhaps ready for this uncertainty that Sumitra spoke about. In other words, if we say that COVID-19 is the perfect storm, we actually deny the science that has come before it. We deny the fact that it has been known that a pathogen like this might emerge. We almost make ourselves as people helpless, as if we didn't, on the one hand, play a part of it, and as if top scientists didn't expect that this would be happening. So in that moment, there is an opportunity for us to educate in a very adult and mature way, as you said. And I think another way to address that is to actually say that science is evolving. We could use some of those examples, like for instance, the guidance around masks has changed. Some people question that and put into question the guidance of the WHO, when we who know better know that evolving science gives rise to evolving guidance. So that could be a way of use it as a moment for science education, which could be empowering.
I don't have the perfect answer, but one of the things that comes to my mind about this is I think we have to factor in that public have different beliefs, they have different value systems, they have different positions and opinions. And their understanding of epidemics also stems from their own social background. So we need to keep communication at the center and not as just like an arm, right? I mean, it's not just an arm that is helping health officials. I think it has to be center to this. And I think if it is done from the beginning, it will be easier to also then communicate uncertainty. Being honest and transparent and telling people that, listen, we don't know when this will end. We don't know at what point we'll get a vaccine. We don't know how this might actually turn out, or how this is going to span out. I think being honest will really help. And that's what I mean when I say that there is a lot of one-way communication happening. We have this tendency to believe, and as someone also who's worked in the development sector and has designed advocacy strategies, I think general tendency is that the community does not know, they will not get it, here's our solution. And I think that's not how it works. We need to factor in what is their understanding and how can we work along with this community to explain to them the challenges. And I think I would just want to end with this one really beautiful video that I saw which went viral. I don't know from where it is, but I know it is some part of India. People are saying it's from Kerala. But there was this, you see this police officer approaching a homeless man, trying to give him, and he says that he doesn't have food. He goes back, brings the ration, gives it to him, and wants to offer it to him. And the homeless man is telling him, no, you stand there, you put the food down. I mean, there's no audio to this, right? Everything is visual, or it's like a CCTV footage that we're watching. And that made me think, how did a homeless man, who we all assume will have no access to any sort of information mediums, right? Like a TV or a mobile phone. How did he get this information about physical distancing? He probably got it from a peer. He got it from somebody in the community who told him what is happening around him in a language that he understood. And I do believe that we really need to just move away from this very patronizing tone that we tend to take, that they don't understand, so we have to make them do this, so we have to tell them to stay at home. I think just telling people why they need to stay home could really help us, because they become peer communicators. And we've seen this in other health interventions. If you tell somebody who has somebody in the family affected by a certain disease, and you can actually very, very beautifully turn them into peer educators. And I think this is the power of language. This is the power of communications, which we really need to now start harnessing. So communicating about uncertainty, do it in as honest manner as we can. We don't know, and that is the reality of it.
Thanks, Padma, for that insight. So the last question that I would like to pose is, what is that one message you could offer to those shaping the discourse? And these are our policymakers, the media professionals, scientists, communicating with the media. What is that one message that you would have for them to help shape this discourse better? So Ida, maybe we can start with you.
Okay, tough one, but I'll say new, not new. It's a novel coronavirus, but some aspects of it are not new. There have been coronaviruses before, so kind of, yes, there's newness. There are things that science is still discovering, that we are still discovering. We're discovering how to live in lockdown, etc. But at the same time, it's not as if there hasn't been coronaviruses before, for which in time health solutions have been found.
Soumitra?
One message is that I think we've really not, we need to look going forward. We need to really pay attention to science communication. We've really not done that very well. Even in India Alliance, for example, we're only now looking at, say, research management. But I think science communication is something that we've not paid a lot of attention to, and not treated it as important as doing the research and the science that we do. We seem to have lost, or we seem to have to reinvent lessons that were learned. So we learned a lot of lessons, say, from the HIV epidemic or the HIV crisis in the 80s and 90s. But we seem to have lost a lot of that learning. And it stayed only HIV specific, because I don't think we paid enough attention to the importance of science communication and health communication. So maybe this is a lesson out of all of this. Going forward, we should be doing much more with that.
Thanks, Padma, last words.
I think just taking off from what Soumitra was saying, I think newsrooms, I think one thing that we have to realize with this pandemic that has happened is a lot of the city reporters and reporters who were on other beats have now all turned into pandemic or the COVID reporters. And this is a reality in newsrooms, which are also shrinking in size now. We're seeing, massive layoffs happening across India and other newsrooms around the world because of the pandemic itself. So this means that the reporters themselves are having to double up. People who had perhaps had no prior experience in health reporting are having to have like a quick, sort of a learning graph, if I could say it, in understanding the pandemic, in understanding the science behind it, and trying to sort of synthesize it for the public. I think there can't be a better time than now for editors and newsrooms to actually invest in sort of training reporters on how to make that jump. And I feel like we had a bit of time and we have now lost the time in the thing. I mean, we have probably had time in January and February as editors. And I even, talk about myself. We're a small team of 5. We had time to, we should have actually put processes in place where we help journalists themselves to understand and to how to, do simple reporting, to do more empathetic reporting. But all the time was lost. And I feel like there can't be a better time than now to sort of start investing in health communications and start understanding why health is very political. Health is not just a beat that is given to, often the women in the newsroom are given the health beat. It's not a fluff beat, it never was, it never has been. And I think we are realizing it more than ever why health communications is so important and why we need to invest more in also training and in equipping reporters themselves with the right language so that they take it out there to the public.
Thank you very much to all the speakers. And thank you also for agreeing to do this webinar at such a short notice and for really taking time out to share these very, very important ideas with us on a very important subject. So thank you again to all 3 of you. We're all learning each day, and there is just so much more that we need to understand and explore with regards to COVID-19. And this webinar has been extremely helpful and valuable in that regard. We do hope to hear from all the participants about what they felt about this webinar, as we plan to host more in this series, and your feedback will be really, really helpful for us. So take good care of yourself and your loved ones, and remember, we're all in this together. Thank you all.
Thank you.
Thank you, everybody. Bye.
Thanks.